What is X-linked inheritance and how does it relate to muscular dystrophy? Imagine a family where some members have muscle weakness that gets worse over time. This pattern often points to a genetic cause linked to the X chromosome. X-linked inheritance is a way genes on the X chromosome are passed down from parents to children. Since females have two X chromosomes and males have one X and one Y chromosome, this pattern affects males and females differently. Males are more likely to be severely affected because they only have one X chromosome. If that X has a mutation, they will develop the condition. Females with one mutated X are usually carriers. They often do not have full symptoms because their second X chromosome can compensate. However, sometimes due to a process called X chromosome inactivation, some female carriers might show mild symptoms. In muscular dystrophy, especially Duchenne Muscular Dystrophy and Becker Muscular Dystrophy, the inheritance pattern is X-linked recessive. These conditions are caused by mutations in the dystrophin gene, which is located on the X chromosome. Since males have only one X chromosome, inheriting a mutated dystrophin gene means they will develop muscular dystrophy. This leads to progressive muscle weakness and loss of muscle tissue over time. Females who carry one copy of the mutated gene usually do not show full symptoms but are considered carriers. Sometimes, due to skewed X chromosome inactivation, they might experience mild muscle weakness. Key points to understand about X-linked inheritance and muscular dystrophy include that affected males cannot pass the condition to their sons because they pass their Y chromosome to male children. Instead, all their daughters become carriers. Carrier females have a 50% chance of passing the mutated gene to their sons, who will then be affected, and a 50% chance of passing it to their daughters, who will become carriers. Because of this pattern, muscular dystrophy tends to affect males more often and more severely, while females are usually carriers with variable symptoms. Understanding this inheritance pattern is very important for genetic counseling. It helps families know their risk of passing the disorder to children and guides decisions about genetic testing and family planning. Medical professionals often recommend that carrier females be monitored, as they can sometimes show mild symptoms or pass the gene to their children. This knowledge allows families to make informed choices and seek appropriate medical advice. In summary, X-linked inheritance explains how mutations on the X chromosome cause conditions like Duchenne and Becker muscular dystrophy. It primarily affects males, while females usually act as carriers. This pattern of inheritance helps explain why muscular dystrophy runs in families and guides medical management and genetic counseling. Always consult healthcare professionals for personalized advice, as individual experiences and risks can vary.